Next we have Lauren Stewart.
Good morning. I'm Lauren Stewart with Americans for Prosperity, and on behalf of our thousands of activists and communities across the country, I want to thank the Great American Healthcare Alliance and Rep. Burlinson for bringing us together to talk about what remains a top 3 issue for American families: healthcare. And I mean healthcare, not health insurance, because the two are not one and the same. At Americans for Prosperity, we believe all Americans should have a personal option in their healthcare. Something that fits the unique needs of their families, not a one-size-fits-all system designed by government or dictated by insurance companies. Our communities reflect the full American experience. We have veterans, small business owners, minorities, moms, dads, grandparents, and young people who are just starting out. And too many of them are boxed out of some of the wonderful health tools and key access points that would actually work for their lives. The encouraging, though less mentioned news, is this administration and Congress have taken historic steps to take power away from bureaucracies and shift it back to patients. The major reforms in the One Big Beautiful Bill, no, not the reforms in Medicaid, but the expansion of direct primary care, the historic expansion of health savings accounts to millions more Americans, are giving families real control over their health care, and they're wildly popular. Both of these issues pull across party lines at 80%. That tells us Americans aren't divided on this, they're united, and Congress should be too. In my house, growing up, there was a simple golden rule: he who has the gold makes the rules. So my dad always got what he wanted for dinner. And right now, in American healthcare, the government and insurance companies hold the gold, deciding what care you get, how and when you get it, and what it costs. The president understands this and has encouraged Congress to expediently solve for this. And this is where solutions like Rep. Burlinson's plan are so well positioned. By putting patients in control of their own healthcare dollars, correcting incentives and lowering costs. Because at the end of the day, moms and dads, not bureaucrats, know what's best for their family's care. I also want to thank President Trump for speaking plainly and effectively about healthcare in a way that has resonated with the American people. When leaders talk about healthcare and the way families experience it, people listen, especially when their exact feelings and pains have been echoed. As we look ahead, we encourage President Trump and Congress to keep building on this momentum. The conservative-led health policies, like Rep. Burlinson's Great American Health Plan, are meeting the moment for what Americans want in their healthcare. The narrative that there is no plan can and should be squashed with solutions like this and solutions that have been signed into the law, and more solutions that exist on Capitol Hill to empower families in their healthcare. Americans for Prosperity would and will support any initiative to advance a personal option for all Americans in their healthcare, and we're happy to continue with Congress and this administration to make it happen. Thank you.